medical tests, scans, and incorrect diagnosis aimed at unfairly generating revenue for the facilities. The second part, Mr. Speaker, sir, is, has the government conducted an inquiry into this matter, and if so, could the Cabinet Secretary Health table the report on its findings? Lastly, what measures has the government put in place to ensure accountability by healthcare facilities and to provide compensation to victims of medical insurance fraud? Thank you, Mr. Speaker.
Madam CS, can you answer the question?
Thank you very much, Speaker and Honorable Senators. It is always a pleasure to come to the Senate to appraise the Senate on matters in the Ministry of Health. And I'm happy to respond to this question that has been raised by the Honorable Senator of Kisumu, Professor Ojienda. And Honorable Speaker, I would like to request that after I respond to the question raised by Professor Ojienda, if you may allow me to also appraise the House on the ongoing crisis that we have at the Ministry of Health.
Honorable CS, I'll give guidance that you first answer the question, and then I'll give you an opportunity understanding under 51C, 6C, to give that statement. So first we dispense off the question by Senator Ojienda, avoiding the matter of the strike so that we can give the CS that opportunity. And then after the statement that she has, I will open to the senators maybe to ask a few questions on that particular matter. So proceed, Madam CS.
Thank you, Honorable Speaker and members. The question was for I to confirm that there is widespread medical insurance fraud that is perpetrated by health facilities in Kenya, and particularly within the private health sector, through practices such as unnecessary medical tests, scans, incorrect diagnosis, aimed at unfairly generating revenue for the facilities. Honorable Speaker and members, the issue of medical insurance fraud committed by health facilities in Kenya, including the private sector, is indeed a serious concern that has received attention from the Ministry of Health, regulatory authorities, and enforcement agencies. There have been reported cases of facilities engaging in fraudulent practices to unfairly generate revenue, such as impersonations, raising fake claims for patients who never received any service, ordering unnecessary tests or procedures, providing incorrect diagnosis, and inflating bills submitted to insurance providers. These fraudulent activities not only harm patients by subjecting them to unnecessary medical interventions, but also lead to financial losses for insurance companies and undermine the integrity of the healthcare system. Consequently, the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have taken action to address these issues, including suspending facilities found guilty of engaging in fraudulent practices. Currently, the prevalence of medical fraud as per external actuarial analysis stands at 20%. It is important for stakeholders, including insurance providers, regulatory bodies, investigative bodies, and law enforcement agencies to collaborate in identifying, investigating bodies, and law enforcement agencies to collaborate and identify, investigating and prosecuting individuals and facilities involved in insurance fraud. By enforcing strict regulations, conducting thorough audits, and promoting transparency and accountability in healthcare delivery, we can collectively work towards combating fraudulent activities and safeguarding the interests of patients and insurance beneficiaries. The second question, has the government conducted an inquiry into this matter? And if so, could the Cabinet Secretary table the report of its findings? I wish to respond as follows, Honorable Speaker and members. I want to confirm that the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have been actively addressing cases of medical fraud within the healthcare sector. Through joint efforts and investigations, several facilities have been identified and subsequently suspended for engaging in fraudulent activities that compromise patient care and violate ethical standards. I would like to note that authorities have indeed taken steps to investigate and address instances of medical insurance fraud. Efforts have been made to scrutinize the practices of healthcare facilities, assess compliance with regulations, and hold to account those found to be involved in fraudulent schemes that are detrimental to both patients and insurance providers. There are ongoing investigations by the Ethics and Anti-Corruption Commission, the Directorate of Criminal Investigations, involving 10 healthcare providers currently suspended by the National Hospital Insurance Fund Board. I have annexed the list on my response. As we collectively strive to uphold the integrity of the healthcare system and protect the welfare of patients and insurance beneficiaries, I encourage continued collaboration among stakeholders, effective enforcement of regulations, and clear communication to promote trust and accountability in healthcare delivery. Question 3, what measures has the government put in place to ensure accountability by healthcare facilities and to provide compensation to the victims of medical insurance fraud? Speaker and honorable members, the government of Kenya has implemented and is working on various measures to enhance accountability and combat medical fraud within healthcare facilities. Some of the efforts that the government has put in place is health facility census, and this we did last year in August. The government conducted a comprehensive census of health facilities to create a database that facilitates the monitoring and regulation of healthcare services. This initiative aims to identify and verify facilities to ensure compliance with standards and detect any unauthorized fraudulent practices. The second step or measure that we have taken is repealing of the National Health Insurance Act of 1998. The decision to repeal the Act and the enactment of the Social Health Insurance Act 2023 is a strategic move by the government to strengthen regulatory frameworks and enhance oversight mechanisms within the healthcare sector. By enhancing the Social Health Insurance Act, the government will introduce updated provisions that safeguard against fraudulent activities, improve transparency, and enforce accountability measures for healthcare facilities and providers. Honorable Speaker and members, I would like to thank you because this House participated in enactment of those laws during the process. The ministry really appreciates the Senate for the effort that they put in. Honorable Speaker and members, we have also we are in the process of procurement of a smart digital system. The government is in the process of acquiring a smart digital system designed to combat fraud activities. This signifies a proactive approach to addressing malpractices in healthcare delivery. The sophisticated digital system will streamline data management, facilitate real-time monitoring of healthcare transactions, and employ advanced analytics to detect anomalies or irregularities that may indicate fraudulent behavior. The system will be integrated with approved clinical guidelines to ensure patient management is standardized. Fourth is enhanced monitoring and enforcement. The government has intensified efforts to monitor healthcare facilities and enforce compliance with regulations. Enhancement of oversight through frequent inspections, audits, and performance of evaluations is going to enable regulatory bodies and the Social Health Authority to hold facilities accountable for adherence to ethical standards, quality care, financial, and transparency, thereby reducing the likelihood of fraudulent activities. Fifth, creating public awareness and reporting mechanism. The government is also focused on raising public awareness about medical fraud and encouraging individuals to report any suspicious experiences of fraudulent practices in healthcare facilities. This will be done by promoting transparency, accountability, whistleblower protection, and the government will empower the public to play an active role in combating fraud and ensuring accountability within the health sector. Regarding compensation of victims of medical fraud, the Ministry of Health and its agencies are not expected to compensate any victims of medical insurance fraud. However, the Insurance Regulatory Authority may provide more detail if there have been compensations of victims of medical insurance fraud. Honorable Speaker and members, I submit. Thank you.
Thank you, Honorable CS. Professor Ojienda, do you have any supplementary question?